Hey guys, welcome back to part B of our ICD-10 CM Factors Influencing Health Status for coding examples. I started this video and we were interrupted by a fire alarm, which was a false alarm, which is a good thing because now we can continue on with our coding. So where were we? I believe our last thing we looked at category Z02 and some of the symbols and information pertaining to this section. So I'm looking in my ICD-10 CM code book, and I can see that Z02 has a list from 0 through 8, as well as 9. So if I notice this, I have 0 through 9 with various different options. Now remember, with most of your ICD-10 CM coding, the character for 8 tends to represent other, while the character for 9 tends to represent unspecified. And so both of these should only be used if you've adequately looked at everywhere else to see if your information, first of all, is specified, as well as if it's identified. One of the things to keep in mind when you're looking at these is that every category code has different kinds of breakdowns. So what might be an other category depends entirely on how the category itself is defined. So when I look at Z02.0 through Z02.7, I see that the way that these ones are going to be sorted are the types of exams for administrative exam. And so in my book, it shows me the differences between the codes in green. I really like that because I can define which one is which and what the difference is very quickly by doing that. So when I look at Z02.0, I see that it's an educational institute. Z02.1 is for pre-employment. Hey, that's our code. I still want to look and make sure there's nothing that further identifies more information about the patient. I'm probably not going to, but it's still important that we look at all options within the category before finalizing our selection. Z02.2 is a residential institute. Z02.3 is recruitment to armed forces, and ironically isn't colored in green. Dot 4 is driving license. Dot 5 is participation in sports. Dot 6 for insurance purposes, and Dot 7 for issue of medical certificates. Also, it's good to see what's in here. Even though you already know that your code is Z02.1 as seen in the code book, in the tabular, as well as the alphabetical, as new coders, you should always look and see what other types of things are in here because you're learning it and you want to get an idea of what to expect the next time you're in this section. Well, that's it for Z02.1. I do want to make sure there's no additional symbols like this one that we saw next to the category code, which there are not. I want to make sure also that there's no exclusion notes, which for Z02 there are not, or Z02.1 there are not, I should say. So I can say with certainty that my code for this encounter is in fact Z02.1. Great, let's go ahead and code one more scenario before we're done with today's review of Z codes. And when we come back on our next video, we'll be looking at additional information on factors influencing health status. We'll do a couple more examples and some really strong focus on moms and babies. All right. So our next example here is for patient Michael Gallup, who was seen on date of service October 16th, 2018. The S for our SOAP note indicates that this is a neonate, was born 8 hours ago via spontaneous. Actually, you know what? Let's skip that one. We'll come back to that tomorrow when we're talking about, or our next time when we're talking about babes and moms and babes for our newborns. All right, so I'm going to skip over a couple here on the bottom of page 539. For our patient, Oglev Lezek. They have some interesting names they come up with here. Okay, so this is a 13-year-old male who was last seen in this office for his back-to-school annual exam 3 months ago. The exam revealed a healthy young man without any significant medical history. Okay, so why is he here if he's That doesn't tell us anything. We're going to have to read further to determine what is the purpose of our visit. Okay, so continuing to read. Today he presents complaining of a cough and sore throat of approximately 1 week duration. He is accompanied by his mother. He and his mother deny fever, nasal congestion, or runny nose, and he says he feels more tired than usual. His mom states that she can't get him out of bed to go to school. He has been truant from school for over the last 6 weeks, and he states his mom won't get off my back. He admits that his grades have been dropping, and he did quit the baseball team. Mom leaves the room, and patient admits to smoking pot every day, sometimes several times a day. For the last month or so, he denies any other drug use and states smoking pot is no big deal. Okay, so now that we've gotten to the information here, we still don't have quite a purpose, but we know we have a couple of signs or symptoms and pot smoking. Now keep in mind, it's all up to what the provider says at the end that's going to determine exactly what diagnosis we're looking for. Okay, under objective, the physical exam is remarkable only for mild erythromatous throat without petechiae. Lungs are clear and the rest of the exam is normal. Vital signs are also unremarkable. The provider has a detailed list of counseling on this patient, saying that the patient was assured that doctor-patient confidentiality is secured. They discuss side effects and risks of abusing pot. He states that he tried to quit but can't make it through an entire day without smoking. It is pointed out to him that his pot use is already having a negative impact on his life. He understands that his parents need to know about this, but he must tell them himself. We discuss options and methodologies for his quitting with reduced effects, and he agreed to regular surveillance. Okay, so at this point, as a coder, you may say, okay, I saw the words abuse and use for marijuana. Would we code this? Okay, the answer is still uncertain, but if you turn to the next page, you'll see the provider's assessment is marijuana abuse counseling, not use or abuse. So the answer to that is no. We would not code use or abuse for marijuana because the provider didn't give him that diagnosis. In this case, he just referred the patient to a drug counselor. Now, if the provider had been providing treatment for the said use and abuse, this might be an opportunity where you would want to query the provider and say, look, I see that you've indicated the diagnosis marijuana abuse counseling. Would marijuana abuse also be appropriate? In this case, he did not say that the patient abused marijuana. His statement was that they discussed the effects and risk of abusing pot. And so it's important to pay attention to the details. That's where the devil lives, and he'll come at you if you code incorrectly. Also, it's important to note that as we're selecting codes like these, we want to be very careful not to select something that could follow that patient around, especially incorrect diagnoses. So for this visit, all we have documented from the provider is counseling of marijuana abuse. And so my first part that I'm going to start in my alphabetical is not marijuana or THC use or abuse, but rather counseling, because we're only talking to him about what could happen with marijuana abuse. So I'm turning in my alphabetical here to counseling, which will take me a minute because I'm always slow for some reason at this point. I always have to go through my ABCs. I feel like I'm the only one, but I guarantee you everybody listening to this video at some point has laughed at that. And if you haven't, then we can't be friends. Okay, so I find counseling on page 110 of my ICD-10 CM book at the bottom of the middle column. Now, the first thing that I want to identify is that there's several different types of counseling going on to the next row. And again, just like earlier, I'm going to read through this first section. I remember the term abuse was used because we were counseling about abuse. And so there is abuse as the first option here, but abuse not elsewhere classified or perpetrator and victim doesn't really apply to drug abuse. And so we're going to keep going. We see child abuse, and then we continue with our terms. Now, remember, in the textbook, it said marijuana abuse counseling. And so we're going to use all of those terms, not just the first one we come to. One thing that I'm keeping in my mind is the medical term for marijuana, which is cannabis. And so I look for cannabis, which I did not see. I do find drug abuser, but I'm going to keep going. And I also find substance abuse. I do not find marijuana abuse, but I do find under substance abuse the term drug, Z71.51. So I'm going to start there, and I'm going to see if that might include marijuana. It seems like it would. And remember, in this case, it's encounter to counsel about these things, not a diagnosis that they have these things. Okay. Okay, so just as earlier, I'm going to start by flipping to my Z section. And even though earlier we already looked at the section for chapter 21 of the coding book, factors influencing health status, and we saw that there were no inclusion or exclusion notes. Every time you look there, it's good to just kind of refresh because we may be coming back to this code after we've coded several different other types of visits which did not include Z codes. So when you come back here, just always kind of glance at it, be familiar with it. You want to look at the category code Z71 and see which block that falls under. Z71 does fall under the block for persons encountering health services in other circumstances and starts at category code Z69. And so I want to look there as well to see if there's any inclusion or exclusion notes for this block. I find category code Z69 on page 1276, and there are no exclusion or inclusion codes for this category block. So now I can go to Z71. So this is a part of what I always tell my students, read up and down. Read what else is there. Make sure you start at everything that builds the code because it can oftentimes, it's not going to make any difference, but sometimes it's going to make a huge difference and a huge difference to your payers. Okay, so I go to Z71 and I notice off the bat that this is another category code with one of those fourth digit characters saying that it needs more than just the 3 characters to go on. So I'm at Z71. Persons encountering health services for other counseling and medical advice not elsewhere classified. Okay, so remember earlier I said only go here if you've looked at every other option. Now I feel by looking at substance abuse for drugs, this has looked at several other options. And of course we'll identify it further to make sure that there's no additional codes needed. But in this case, I feel like we can continue on. Okay, so notice that this has an excludes 2 note for contraceptive or procreation, counseling or sex counseling, and it gives us codes for both of those. Looking back at my counseling purpose, I see that this is for symptoms and pot smoking, not for contraceptive or sexual encounters, and so I can continue from Z71 to look at my options from 0 all the way down through 9. Okay, and so again, just like we did earlier, we're going to look at each of these fourth character options to see which one applies best, keeping in mind that probably number 5 is going to be the one we look at. Okay, so I'm going to start just at 0. Person encountering health services to consult on behalf of another person. This would be an example where a patient has a third party getting a consult for them. This would not be our patient. Person with feared health complaint with whom no diagnosis is made, not our patient. Person with consulting for explanation of examination or test findings. Okay, this would not, again, not our patient. Deteriorary counseling and surveillance, alcohol abuse counseling and surveillance, drug abuse counseling and surveillance. Okay, so in this case, this one is the one we found earlier, and we'll keep it in mind. There's also tobacco abuse counseling, human immunodeficiency virus counseling, or HIV, and then other and unspecified options. So it's definitely not unspecified. It does fall under the category of drug. And here we have our first definite information saying that we should use an additional code. So even though it doesn't say it in the book, this would be a purpose to query. Because the provider did not identify the patient as having either abuse or use, we can't list patient with marijuana abuse or use. So we do need to verify that that would be appropriate for us to list along with the information. Under Z71.5, aside from using the additional code, which in this case for this video we're just going to say that would be something to query because there wasn't enough information with a precise condition. Then I would look at the difference between 51 and 52. And the difference here is one is for the drug abuser themselves and one is for a family member of the drug abuser. So in this case, with the query, Z71.5 would be appropriate. And so does confirm the code we have here for Z71.5.1. I myself would not be comfortable without first talking to the provider to make sure that drug abuse or use should be listed. Even though they said marijuana abuse counseling, some offices may have different rules and guidelines, and they may have something where the provider has indicated to the office, if I say this, then yes, this does include the fact that they have abuse, but abuse codes do require additional information, such as whether or not it's active, in remission, or unspecified, and it would be better to query the provider to get all of that detail. That's it for our coding examples for our first half of factors influencing health status on Z codes. I hope you've had fun watching these videos and watching me take off during a fire drill. We'll be talking to you next time where we look at some more examples with moms and babies and other types of encounters for routine visits. Stay tuned, we'll talk to you soon.